This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So you went to a talk the other night about STDs that you said was a great talk.
It was interesting because, my patients are generally older patients, and STDs don't come into the picture very much. They do to some extent.
But recently we have had a lot come through.
Yeah, we
regarding.
have. And what I learned from this discussion and presentation last week was the increased incidence of mycoplasma. It's not one of the STDs that we generally recognize, but it seems to be cultured more and more. And the treatment is a little different.
Wait, what is it? What is it?
Mycoplasma.
Mycoplasma.
Yeah.
So is that an actual term for an STD? Is that a new STD?
Yeah, I suppose it is, really. It's we don't hear it referred to very much, but the results from the labs come back with that description.
And how does it present?
Often frequency of urination, discharge, can be more severe in terms of pelvic inflammatory disease, abscess formation. But most of the time, it's it presents like most STDs, like gonorrhea and chlamydia, trichomonas, with those more minor symptoms. But high-risk patients should be checked all the time, every time they come in for an examination.
How are patients tested for it? With a blood test or a swab?
It's a swab, yeah.
And then how are they treated? Antibiotics?
Antibiotics, yes.
Just one round?
Usually, yes. But it's there are specific regimens that are recommended for that.
And is there a carrier of that? Does somebody carry that and give it to a bunch of people? Or is it just something people get? I mean...
partners should be checked for sure. And I think there are asymptomatic carriers. So anytime we find it with a patient, we've got to let them know and encourage them to have their partner treated. And in fact, a lot of places will, physicians treating these conditions will give the patient a treatment and write a prescription for the partner as well, without them necessarily being seen, because that is probably the best way to try to extinguish it.
And why in this talk did they say like why this was suddenly more popular as an STD right now?
Popular is not really the right word.
Trending?
Trending maybe. But it's it's just the sexual activity of young people and the lack of careful sex all lead to this, and it's just something that's contagious, and it's all of these diseases are more and more are contagious and will just be prevalent for a while until immunity is built up to it, till there's a better treatment for it, or there are other ways of preventing it.
Did they go into the lockdown and all that?
Yeah, there were fewer cases during the lockdown because people weren't getting out and socializing as much. This is really an interesting and important subject because the incidence is increasing significantly, and it's got to do with changing habits, teenagers and other young people rather than the population as a whole.
Yeah, I think it's really important too for everyone to be educated about STDs. Thank you.
You're welcome.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.